Cool. So, yep. Okay. So I guess I will start through here. So I'm going to be doing a quick talk on, wait, just to verify everybody can see my screen, right? Okay, I'll take that as a yes. I'm going to be doing a talk on a review of using near-infrared
Can't see your
photobiomodulation.
screen.
You can't see my screen? Okay. How about now?
Yeah.
Okay. Okay, cool. Sorry about that. Anyways, so I'm going to be doing a talk today about the review of near-infrared photobiomodulation for oncological treatment. This is a project that I'm working on with Dr. Laraco, or John, as you guys might know him. And yeah, overall, we're super excited. It's a literary review, and yeah, just without further ado, I guess first I would like to start with like a quick introduction of me. That's me on the right. I was in Gatlinburg, Tennessee with my friends. And yeah, so essentially my name is Bibhus Luitel, and I recently graduated from the Ohio State University with a bachelor's in engineering from the electrical and computer engineering department. By day, I currently work as a software engineer. However, I have a lot of research interests outside of just working in software engineering, and mainly I have a lot of interest in neural engineering through the work that I've done in the past with Dr. Laraco, and then a lot of BCI and HCI stuff that I'm interested in. And also, I have a slight niche interest in urban planning, particularly around transportation networks. I find it very interesting about like the effects of public transportation on just quality of life as well as traffic control and modeling that. So yeah, that's a little bit about me. So moving forward with my talk itself, I wanted to talk a little bit about what photobiomodulation actually is. And so photobiomodulation, it has had many names in the past before, low-level light therapy, low-level laser therapy, cold laser therapy, amongst others that are like similar, but essentially it is the use of near infrared or red light to the hope is to heal, restore, and stimulate multiple physiological processes. And I guess one of the biggest things to know about photobiomodulation is that in itself, it's actually very non-invasive and it promotes tissue repair. And this has been shown clinically in a lot of applications as well. And the way that it works is it exposes affected areas in the body to the low levels of this near infrared light. And then that's observed through cellular components. And then essentially the idea is it should boost the amount of ATP and just promote and stimulate cell function. So now just talking a little bit about photobiomodulation in conjunction with cancer therapy. So photobiomodulation, obviously it deals with the idea of stimulation, right? And so initially, a lot of researchers think that it is contraindicated for cancer therapy because you don't want the actual tumor sites in the cancer cells to grow and be stimulated. And is actually was discovered in some cell cultures that this would be the case. However, because of the healing properties of photobiomodulation, it is actually an open discussion in research and amongst the scientific community on the actual effectiveness of photobiomodulation therapy in actually mitigating these side effects that occur because from these different types of cancer therapies. And one of these, like this diagram on the right at least, it talks about all of the different types of side effects that you can have from cancer therapies, including chemotherapies, right? You have xerostomia, oral mucositis, and radiation dermatitis. Those are like the main focus that a lot of research is doing right now. So now we asked the question if photobiomodulation can actually stimulate cancer. And so what I've seen from my research, and this is ongoing, is that many studies have shown that photobiomodulation can actually increase the growth of cancer cells. However, there is limited research that it actually stimulates the growth of regular cells into cancer cells, is what I was trying to go at with this. And so there is some research that shows that photobiomodulation can actually increase tumor size. Pardon? Okay, sorry about that. Anyways, yeah, there's research that shows that photobiomodulation can actually increase and stimulate tumor sites, but there's limited research to suggest that it can turn a healthy cell into a cancerous cell, essentially. And these are just two studies that I chose to highlight here. And I chose specifically to write and like note the wavelength and the power that was used by these studies, as well as their treatment protocol. And it shows that the tumor size has been significantly increased amongst this configuration here. So now, moving forward, like with the research that we have done, we've been looking into what kind of mechanisms that photobiomodulation actually can have in oncological treatment. And so, given the information beforehand, there are three main ways that photobiomodulation can actually be used in oncological treatment. And one of them is through direct light stimulation, which sounds a little counterintuitive. However, there is some research going on to indicate that because of some properties that photobiomodulation can actually help to directly ablate tumors. The other mechanism is by taking advantage of the differential effect of photobiomodulation between malignant cancer cells and normal cells. And then lastly, there is a stimulation of the immune system that photobiomodulation can actually have in treating cancer. So the first mechanism comes with the direct effect on tumor cells. And this is mainly being supported by the Xing laboratory in China. And they have been working on mouse models, right? In vitro mouse models, as well as in vivo mouse models that are containing basically breast cancer tumors. And what they have discovered is that because of this biphasic dose response curve, essentially this is the idea that there are certain parameters that can be satisfied to kill these cancer cells. And this is a high fluence, low power configuration that was pioneered again by the Dashing laboratory. This can actually help and kill these cancer cells. And then there's been, with this study, that mice were actually cured of cancer, showing long-term immunological memory. Now, the second mechanism is on the differential effect between cancer and normal cells. And this is where we would exploit something called the Warburg effect, right? And this effect, from our research, it's where cancer cells, they rely on glycolysis. And so PBM will actually boost the ATP in cancer cells, and it will enhancing the response to cytotoxic stimuli. In normal cells, PBM triggers ROS production, which will actually protect healthy tissue, and potentiating the killing of cancer cells by this therapy alongside radiation therapy, basically using two different types of therapies in conjunction. And the third mechanism is actually the stimulation of the immune system. And so it has been shown that photobiomodulation can actually, within 72 hours, increase the amount of macrophages, TNF alpha cells, and that can actually be used in conjunction with any sort of photoimmunotherapy techniques to actually promote the treatment of cancer and your body's natural ability to fight against cancer. So now when we look at the evidence of clinical efficacy, essentially there is a preventative method to photobiomodulation, and they focus mainly on the side effects of existing cancer therapies. And it has shown that there is a slight benefit to using photobiomodulation in the healing after chemotherapeutics or other types of cancer therapies. And on average, a lot of the PBM parameters themselves tend to be in that 600 to, let's say, 800 nanometer range and 100 milliwatt power. But this is, I guess, where we would come in with our research and try to answer some of these unanswered questions. So moving forward, this is obviously like an area of research with a lot of questions that are still unanswered and a lot of potential for future direction. So the main questions that we want to ask are, can PBM play a direct role in cancer treatment beyond just symptom management? How do these variations affect treatment outcomes? How do the variations of devices, different laser types, wavelength and power configurations, how do they actually affect treatment outcomes? How does PBM dosage impact a tumor's response? And what are the implications of using whole body irradiation, so using photobiomodulation on the whole body versus on specific sites. And then we're also wanting to explore uh, when is it time to actually use photobiomodulation, at what stage would it be most effective, and how photobiomodulation can effectively be integrated with existing cancer therapies, including photoimmunotherapy. So then we move on to our methodology, which Dr. Laraco and I were working on right now. So essentially, we are looking to establish a PRISMA review, a literary review on the safety and efficacy of photobiomodulation based on newly collected research within the last 5 years, because this is a field that has seen a lot of change, even just within the last 5 years. And our focus is mainly going to be on the configuration and the types of irradiation device itself. So basically, we're going to focus on LEDs versus lasers versus using photobiomodulation with pharmaceuticals, light-assisted photosensitive pharmaceuticals. And basically, we want to do a literary review on an analysis between the relationship between the wavelength, the power, and the outcome, and what kind of outcome we would expect based on the wavelength and power for different types of cancer. Uh, yeah, and so essentially that is the bulk of what I'm doing right now with with Dr. Laraco, and I will leave it up to any questions that you guys may have regarding this.